Hi, I'm Peter Kay. Welcome to another great segment of 5 Minutes to Fitness Plus TV. My clients always ask me, Peter, what can I do to exercise even though I have knee pain and do I have to stop? Well, the first thing you want to do is check with your physician and make sure your physician or your healthcare practitioner is fit and healthy so that they can give you great advice and they don't just tell you, well, if you have pain, stop exercising. I think that's the worst thing you can tell someone. So find a healthcare practitioner who's fit and healthy themselves so that they can help you out with real life experiences. So we're going to talk about exercising with knee pain and what you can do. Very, very briefly, let me just talk about some of the areas of knee pain. If your pain is on the inside joint line, like right here of your knee, it's possible, it's just possible that you might have a meniscal sprain or strain or even a tear. A sprain or a strain is really much more common and it causes pain on the inside. Just because you have this, by the way, and even if you have a meniscal tear, it doesn't mean you need surgery. It means you want to proceed with caution and you want to maybe try some of these exercises after you check with your healthcare professional, right? If you have knee pain and it's generally localized around the kneecap, it feels like maybe it's deep or it's underneath, that might be a general, it's called chondromalacia patella, which really means there might be swelling in the knee, there might be some arthritis in there, there might be a little bit of a torn cartilage or frayed cartilage. We all have that at some point in our lives. I have it myself. If you have knee pain that is below, just below the knee, right by your tibial bone, that might be a tendinitis, a patellar tendinitis. If you have locking of the knee, buckling of the knee, if you get out of your car or if you turn away or pivot and your knee gives out on you, or if you have trouble going downstairs, you definitely want to see your healthcare professional then because you might have a more serious knee problem. But if you've just got some knee pain, and especially when you're doing some running or some squats and lunges, here are some strategies to help you out, okay? I got my kid's soccer ball here. This could be like a dollar ball that you get from the supermarket. It doesn't have to be anything special. Squats are one of the best exercises we can do as human beings to strengthen our entire lower extremities. And if you do them right, you can strengthen your core as well. So let me show you the correct way to do a squat. And we're going to squeeze the ball gently in between our knees. I'm going to tell you why in a second. I'm actually going to turn this way and do it. You always want to pretend when you're doing a squat that there's a chair behind you and you're sitting your butt down in the chair and you want to come straight back and then up. The reason I have the ball in between my knees is I'm squeezing gently and that strengthens the muscles on the inside of the thigh, which stabilizes the kneecap. It's called vastus medialis obliquus, but you don't have to worry about that. It strengthens and helps the patella align. So as I squat, my kneecap goes up and down in the right position. It doesn't go side to side, which causes a lot of that pain, okay? The secret to a squat is make sure your knees do not go forward of your toes. Don't do that, do this. That's why you got the seat in behind you here, okay? So sit back like this, and I would start with 5. If you're fine with 5, do 10, do 15. Work your way up. If you can't even do that, what I recommend you start with, and I don't mean to say it like that if you can't even do that, depending on what you could do is what you have to work with and that's your starting point. And there's no right or wrong. What we're going to start with is a basic squat. And it's an isometric. You've seen this before. You're just coming down to a comfortable level. It might be a millimeter, it might be 20 inches. You don't want to go past 90 degrees like this because you'll stress your knees. And you just want to hold that for 5 seconds, for 10 seconds. You could even do this up against a wall and then stand up, move your legs around and move on to the next exercise if you're doing a circuit like my 5 minutes to fitness routine. And then you're going to progress from that with the squats and doing more and more. I have had people start with a 5-second hold like this, and now they're doing 100 squats a day up and down, pain-free. So you never know what's possible till you try. The other exercise that people have problem with is a lunge. So a basic lunge is stepping forward and then coming back. And I always like to switch for balance. So again, the secret with the lunge is not going forward like this. This is what people do. They go forward, they stress the kneecap. You just want to step straight out and come straight down. If you have knee pain, you could hold on. Start with isometrics. Just hold it for 5 seconds, 10 seconds, 20, whatever you can do, and then switch. Same thing in a comfortable position. When you start to feel stronger, maybe you can start oscillating up and down. And you do that until you get the burn, and you do it for 10 seconds. And then eventually you work towards regular lunges, okay? And then you could also do reverse lunges. All you're doing is stepping back with the lunge. This is a lot less stressful for a lot of people. It's actually easier for some reason. So you can try those. Having said that, the lunge still might cause you pain, so don't do it. Replace the lunges with the squats. I find a lot of my physical therapy patients can do, when they have knee pain, they can do squats, but they can't do lunges. So just do the squats, it'll be enough, okay? Start with that, check with your healthcare professional. I'm Peter Kay, and I'll see you on 5 Minutes to Fitness Plus TV.